Hi, my name is Lisa and I'm from RT 102. Today I'll be demonstrating 4 views of the shoulder. We have an AP external rotation, an AP internal rotation, an AP oblique projection, scapular Y, and the last will be the supero-inferior axial projection. My technique for my shoulder will be anywhere from 65 to 75, and the range will be 5 to 13 mass. Okay, I'm ready to set up my rope. So my tube is detented at 40 inches, and my tube is also at a 90-degree perpendicular to the IR. I have a 10 by 12, which inserts, oops, let me go get my cassette. I have my 10 by 12 cassette, and I'm going to insert it landscape into the wall bucky. I'm going to look at my collimation, and I'm ready to get my patient. Make sure that I have my, there it is, my shield is ready. Okay, I'm ready to get my patient. I'm going to get my requisition, and I'm going to verify the order with the doctor in the computer. I'm going to enter my patient name, last name, first name, date of birth, gender, and then I'll enter my exams. All right, I'm ready to get my patient. Okay, Mrs. DeWitt?
Yes.
Hi, Mrs.
Hi.
DeWitt. My name is Lisa. I'm from the radiology department. Yes, I'm here to do some x-rays. Can you tell me your first and last name, please?
Elena DeWitt,
Okay, and how about your date of birth?
9/27/72.
Okay. Is there any chance that you're pregnant today?
No.
Okay. So the doctor's orders say that we're going to be doing some x-rays of your shoulder. Can you tell me what's happened? Or?
I fell. I was on my bike and I fell and I landed on my shoulder and it's been painful.
Okay, so right about here?
Yeah.
Okay. All right, so it's your left shoulder, correct?
That's correct.
Okay. Any surgeries in the past I have to
No.
note? Okay.
No.
All right, so what I'm going to have you do is I'm going to have you put a gown on and take your jewelry off,
Okay.
and then when you're ready, we'll get started.
Okay.
Okay, perfect. All right. Mrs. DeWitt, are you ready?
I'm ready.
Okay, let's come on over here.
Okay.
I'm going to have you step up to this board with your back against the board, face me.
Okay.
Perfect. And I'm going to put a shield on you. All right, so what I'm looking at is I'm looking for your left shoulder kind of be in the center of that plate. There we go.
Okay.
Okay, and relax. My central ray is going to be entering an inch inferior to the coracoid process. And I'm going to have you just shift a little bit. Hold real still, right there. Good. All right. My left marker is in the field. And there we go. What I need you to do, if you can, is I need you to, your arm pulls away, and I want you to rotate your fingers to the back. So the opposite direction. There you go. So extra right here.
Right there?
Good.
Okay.
Okay. So central ray entering 1 inch inferior to the coracoid process. The left shoulder. My marker's there. My shield's on. My collimation is 10 by 12, and it's about 1.5 to 2 inches above the shoulder and on the lateral border. Okay, hold real still for me. You okay, Mrs.
Yes.
DeWitt? Okay, good. All right, so my technique is going to be a 70 at a 6 mass, 70 kV at 6 mass. Hold real still for me. Don't breathe. X-ray. Good. Okay, you can relax, Mrs. DeWitt. All right, I'm going to get my cassette. I'm going to set it to the side. I'm going to grab my new cassette, 10 by 12 again. Central ray is entering the same area, 1 inch inferior to the coracoid process. This time we're going to be doing an internal projection. So, Mrs. DeWitt, can you take the back of your hand and put it on the let's see, right about here. Let's take the back of the hand and place it right here. Okay, good. All right, I'm going to shift you over just a little bit, just slightly, right about, yep, that's good. My marker's up, shielding, stay real still for me, real still. Okay, I'm gonna go ahead, my technique for the internal rotation will be the same 70 kV at 6 mass, okay? Stay real still, don't breathe, X-ray, okay, you can relax. Take my cassette out, I'll set it to the side, I'll grab a new film. This time we're going to be doing the scapular wide view, and I will have my film in portrait. Okay. I am going to turn, step forward just a bit for us.
Okay.
Is that okay?
Yes.
That looks like it's painful. Is it painful?
No, that's bad.
Okay. Can you do me a favor? Can you take your left arm and kind of wrap around your waist there? I'm going to have you turn all the way around. And I'm going to have my patient at a 45 to 60 degree angle. So I'm going to place my thumb on the medial part of the scapula. I'm going to rotate her slightly. So I want to make sure that my fingers are parallel to the IR. Relax your shoulders. And I am going to, the central ray is going to enter the scapula-humeral joint. Mrs. DeWitt, I'm going to have you shift you forward just a little bit with your feet, everything, please.
Thank you.
You okay?
Yeah.
I talk kind of fast. Okay, rotate just slightly. Okay, so my central ray is going to enter the scapulo-humeral joint. My left marker is going to be in the light field. My technique for this particular projection is going to be a 75 to 13 mass. Collimate just a bit more. Okay, real still for me. I think I can call maybe a little bit more. Okay, hold still, Mrs. DeWitt. Adjust the shielding. There we go. Okay, real still. Okay, 70 and 13 mass. Hold your breath for me. X-ray. Okay, you can relax. I'm going to have you come over here and take a seat on this chair, the stool,
Okay.
not the chair.
Sure.
Watch your head.
Okay.
Okay. So what I need you to do is I need you to lean into the table. I want your arms slowly extended, and I'm going to have you lean forward and look down and away. Take a peek here. So can you push your shoulder forward? There we go. Very nice. Looking down and away. All right. So my central ray is entering the shoulder joint. My patient is looking down and away. I have my left marker on the 8x10. My patient is shielded. I've collimated. That looks good. My technique for this view is going to be 70 at a 7 mass. Okay. So Mrs. DeWitt, I need you to hold very still. And I'm going to expose X-ray. Beep. Okay, Mrs. DeWitt, you can relax. I'm going to take a look at the views to see how they came up, and then I'll be right back. So just relax.
Okay.
So I'll take all of my cassettes. I'm going to scan them in the reader one at a time. Take a peek at my images to see if they are acceptable. Drop the reader. Okay, that looks good. And then I will critique my evaluation. So critique my images on the evaluation. Okay, Mrs. DeWitt, you're free to go.
Okay.
Watch your head. Take the. All right. So the radiologist is going to view the images. He's going to send the results to your doctor, and then your doctor will give you a call.
Okay.
Okay.
Thank you.
And I hope you do have a great day and take care of that shoulder.
Okay.
You know
Thank
your way out, right?
Yes. Thank
Okay.
you.
Thank you. Bye-bye.
Bye.
Okay. And we're done.